Site selection and device placement. Consideration for adults would be veins in arm are most commonly used. Larger veins of the forearm are preferred over metacarpal hand for rapid infusions, highly acidic or alkaline or irritating infusions. As far as the elderly, hands are not the best initial site due to loss of subcutaneous tissue and thinning of the skin. As for infants, veins on the scalp, dorsal foot, feet are most commonly used. Choosing peripheral venipuncture sites. This varies with client's age, length of time an infusion is to run, type of solution used, and then condition of the vein. In selecting the best site for a venipuncture, remember the VIP, vein infusion patient. For the vein, consider its location, condition, and physical path along extremity. For the infusion, consider the purpose and duration. For the patient, consider the degree of cooperation and compliance and his preference. The Infusion Nurses Society standards and practice state that the catheter should be the smallest size and shortest length that will accommodate the prescribed therapy. Remember, the most prominent is not always the best. Never select an edematous impaired arm. Never select an affected arm of a stroke patient. Never select extremity of mastectomy or dialysis access. Select non-dominant hand, arm when possible. For subsequent venipunctures, select proximal or above to previous. Avoid areas of flexion. Rotate access sites according to policy. Peripheral veins used in IV therapy. Metacarpal is the dorsum of the hand. Cephalic is the radial side of the forearm and upper arm. Basilic runs along the ulnar side of the forearm and upper arm. The antecubital, basilic, and median cubital veins are convenient but kept for blood draws, bolus injections, and PICC lines. The site chosen for venipuncture varies. For adults, the forearm are preferred over metacarpal veins of the hand for rapid infusions that are hypertonic, acidic, alkaline, or containing irritating medications. Make sure to utilize distal portion of the arm, which allows for subsequent venipunctures to move more proximal. The metacarpal, basilic, and cephalic veins commonly used due to the ulna and radius acting as a natural split and allows more freedom for the patient. Common practice. Initial venipuncture to be in most distal portion of arm, which will allow for more subsequent venipuncture to move upward. Veins to avoid. Legs. Circulation may be compromised. Inner wrist or arm. These are small and uncomfortable. Affected arm of mastectomy. Arm with shunt or fistula. Arm treated for thrombosis or cellulitis. Arm with trauma, for example, burn or scarring. Valves. Make sure you insert above the knot. Catheter selection. The smallest gauge to deliver the prescribed therapy at desired rate should be used. For example, a 16 to 18 gauge is common for major surgery. 18 to 20 gauge for rapid infusion of IV fluids, bolus products, viscous meds. 20 gauge used for most IV applications and blood products. 22 to 24 gauge with a 3/4 catheter may be used for the elderly. A 14 gauge through 24 gauge for adults and 22 to 24 gauge for pediatric can be used for blood and blood product administration. This is according to the Vascular Access Policy, Patient Care 42.5. Selecting a catheter. The length of therapy time device will stay in place should be considered. Also the type of therapy, type of procedure or surgery, Patient's age and activity level should also be considered. Also, the type of solution being used, and then the condition of the veins. Intravenous catheters. Angiocatheters, also known as over-the-needle catheter, is a plastic catheter that fits over a needle or stylet, which pierces through the skin and vein wall. Needle is withdrawn and discarded, leaving the catheter in place. This is used for long-term therapy. The butterfly, which is the wing-tipped needle, has plastic flaps and are attached to shaft to hold needles securely during insertion. This is used short-term for single-dose therapy, IV push medications, or blood sample.